Hello and welcome to today's episode. I'm Godfreda and I'll be taking us through a short health education session. Hopefully it shouldn't be too long so we can. Yes. So we'll be talking about kidney failure. This is unfortunately a condition that is becoming quite popular, especially among young people, and it will be good to have more knowledge on the condition than not. And that's the reason for this session. So we'll go straight into it. Yeah, we'll talk about the kidneys very briefly. So the kidneys are a pair of organs, bean-shaped organs in the abdominal cavity, in the abdominal cavity, and they are very important organs in the body. They have a functional unit called the nephron, and this nephron consists of the glomerulus and then the tubules. Now, they all function together mainly. One of the main functions of the kidney is to remove excessive water or excess water and waste from our blood. So from the body, the body has a way of trying to sieve out, it's like a sieve of salt, sieve out the waste we don't need in our blood anymore. That is what comes out as urine. Other functions of the kidney include producing a hormone we call erythropoietin, which helps with blood formation. It also helps with regulating blood pressure. And a lot of people don't know this, but it helps to regulate blood pressure through a hormone called renin, and also helps in the activation of vitamin D for strong bones and teeth. Yes, so the kidney is important for all of these functions, and it's very, very important, as you can see, in the general well-being of a human being. Thankfully, there are two, and so when one kidney can actually function to serve the whole body. Yes, so it happens. Kidney failure happens when both kidneys are not functioning properly. Usually less than 70% of the function is more than 70% of the function is lost. So it results in accumulation of the waste and the excess water and all of those things that it's supposed to remove from the body. Yeah. So when it comes to kidney disease, people usually know of the chronic one, the one that is long standing and everything, but then we have two main types. We have the acute kidney injury, and then we have the chronic kidney disease, that's CKD. So I'll talk briefly about acute kidney injury, and then we'll zoom into chronic kidney disease. But before that, let's talk about some of the risk factors that can predispose someone to getting kidney disease, especially chronic kidney disease. Now, some long-standing or long-term chronic conditions such as hypertension and diabetes can result in chronic kidney disease. The process of the disease itself affects the kidney and may result in chronic kidney disease. Other risk factors include having a family history of kidney disease. So if you have family, especially first degree relatives, such as your parents, your siblings, when they have kidney disease, it increases your likelihood of getting or acquiring kidney disease, right? And also, it's also been seen that people of African descent, so from American research, African Americans are more predisposed or more likely to get kidney disease or chronic kidney diseases, chronic kidney failure. We also have heart conditions, liver conditions. These, when they are long-standing and not well controlled, can result in chronic kidney disease. Smoking is an important risk factor. It affects the cells of the body generally, and the kidney is not excluded. Smoking is a very important risk factor. And what we also know is that age is an important risk factor, meaning the older you get, the more likely, or the higher the likelihood of getting kidney disease. So chronic kidney disease is a more progressive loss of kidney function as opposed to the rapid loss of kidney function as seen in acute kidney injury. Chronic kidney disease can be as a result of a lot of conditions, including diabetes, hypertension, and some kidney conditions like intrinsic kidney conditions, which include polycystic kidney disease, vesicourethral kidney disease, and Alport syndrome. These are all, most of which are hereditary, and you can only find out with the signs and symptoms. So I'm going to talk about the signs and symptoms of kidney diseases. They realize that their urine has reduced, like the amount of urine they pass has reduced, and sometimes it's excessive, but then it almost always comes back to reduced urine production or urine passing. So that's an important symptom. Another symptom is you realize that there's swelling of the ankles or swelling of the legs. Yes, and sometimes the hands even. And then puffy face. Some people have a puffy face. You realize that, especially in the morning. In the morning when they wake up, it's puffy, and in the course of the day, the puffiness reduces. It's a very important symptom. People also see froth in their urine. It's one of the diseases that can cause kidney failure. So when you see it, you report. It's not manly to have excessively frothy urine. It can be a pointer to a more deadly condition. Yes. And then other signs are, you realize that there are signs of anemia. That's the reduced blood levels. So the person gets tired easily. The person has palpitations where they can feel their hearts beating. The person has headaches, unexplained headaches, and chest pain sometimes. These things should come to the hospital immediately. You never know what the cause of the anemia is. Another important one is breathlessness, where when they lie down flat, they cannot breathe. And these swellings, breathlessness, puffy face, as a result of the excess water that the kidney cannot excrete. So that's how you have it. Others can also see blood in their urine. And sometimes you may not even be seeing, but when there's a urine test, they can detect blood in it. And then others can experience itching and generalized itching as a result. In severe cases, there can be behavioral changes, and you can see that the person is, we call it altered mental states, where the person is not themselves. Another important thing, nausea, vomiting, and sometimes the taste of food changes. So these are some of the signs and symptoms. What do you do when you see some of these symptoms? You don't have to see all of them. Sometimes a few of them. Please immediately come to a health facility. We'll run some tests where we'll check your blood levels, and we'll check your hemoglobin levels and the rest of your blood components. We'll also check your renal function test, that's kidney function test, where we'll look out for your blood urea and creatinine, and then depending on the levels, the right treatment will be put in place for you, as well as when you come as well, we'll find the cause of the renal failure, and then the right processes will be put in place for you. So the treatment of kidney disease ranges from just giving some fluids to dialysis and kidney transplant. So it really depends on the severity, and that is where you hear lots of people campaigning for some GoFundMe. It's very cost intensive. So some of them you cannot avoid. Some people were born with hereditary conditions that results in the acquisition of chronic kidney disease, and what can be done will be done. But then for the things that can be avoided, for the things that can be controlled, such as obesity, the intake of nephrotoxins, the exposure to nephrotoxins, the smoking, such risk factors can be modified by the individual to reduce your risk of developing the condition. Also, I would also like to advocate for regular health checks. And this is very important, especially to say to us, especially now as Africans, we are quite reluctant to do so. So I would really advise all of us not to just go to the hospital when we are unwell, but regularly. You can do it yearly, you can do it biannually. You go to the hospital, do a full checkup, not just the kidneys, but the heart, the liver, and other systems as well. As you may have realized from earlier in this session, that failure of the other organs can adversely affect the kidneys. So let's take care of all of them as well. This is even more important for individuals who have some of these risk factors, such as the advancing age and having a family history, especially of a first degree relative who has had this condition. It will be very, very expedient. It will be very, very helpful if such individuals make it a point to go for regular health checks as well. Thank you so much for listening to this. I hope that you took something away from it, and I hope that we all take care of our health from this point on. Take care of our kidneys as well. Thank you. Drink lots of water, unless you be restricted to do so because of a previous health condition. But then drink lots of water. It really, really helps.
Why some people are impatient.
And that doesn't help us become confident.
8-day relationships.